Hi, I'm Robert Mandata, your instructor for Psychopathology. This is an intense course that focuses primarily on Vermont and its response to people considered mentally ill. I actually prefer the terms mentally or emotionally distressed for the simple reason that it's more human and less clinical, therefore less likely to lead to stigma and oppression. Let's look at this cartoon by Jean Thompson of Burlington, who herself has experienced being psychiatrically labeled. The figure is obviously of a depressed woman, a sad woman who's drawn into herself, overwhelmed, overcome. Along the left-hand side are the words discrimination, harassment, low pay, glass ceilings, misogyny, pornography, verbal abuse, assault, battery, rape, incest, mutilation, wife burning, female infanticide. And then the caption. But she has nothing to be depressed about, doctor. What do you call someone whose behavior or thinking strikes you as too sad, bizarre, weird, or maybe even threatening? How do you think about yourself or those you love or know well when you or they are struggling emotionally or mentally? Do you use clinical terms or politically incorrect ones? How do you explain your own fears, anxiety, sexual worries, or dark and dangerous thoughts? Are you convinced that mental illness is biological and hereditary, or determined by circumstances? Both? Neither? These are the kinds of questions you'll be addressing throughout our course, which focuses on Vermont and Vermonters. In fact, most weeks you'll be analyzing case studies of real-life Vermonters. We'll also look historically at Vermont's mental health, correctional, and juvenile systems, which too often have oppressed the very people they were designed to care for and heal. The Vermonters we'll study will tell you their personal stories, which in itself is remarkable because historically those considered mentally ill have been silenced, kept out of the decisions about their care and treatment. But since the 1970s, there has been a growing movement of ex-mental patients, psychiatric survivors, mental health consumers, and sympathetic caregivers and professionals who have spoken out publicly. It's one of the many liberation movements that have dominated American life for over 50 years. For that reason, I want to play for you a song that best captures the hope of oppressed peoples.